Tibial avulsion fracture. What is tibial avulsion fracture? A tibial avulsion fracture is usually an injury to the knee occurring in adolescence during the approaching of skeletal maturity. It happens between the age of 12 to around 16, and it's mostly common in boys. So, what causes tibial avulsion fracture? Most of these injuries occurs during athletic activity involving jumping. So, mostly basketball players get this usually. So, during jumping, this causes violent knee flexion against a tightly contracting quadriceps while landing from a jump, and violent quadriceps contraction against a fixed foot while jumping. So there are many severities of the fractures, so they are classified into type 1 to type 4. These are the pictures of type 1 to type 4 tibial avulsion fracture. As you can see, type 1, it's rare, it's very hard to see the fracture, but it becomes bigger and bigger as the type increases. And this is an x-ray of a person's leg having a tibial avulsion fracture. As you can see here, the tibia and the femur, the joint, the kneecap here, I think it's broken here, somewhere around here. This image is more clearer. You can see the fracture. It's a little bit bigger than it can't be said as a hairline fracture. It's a bit big. I think it's type 2 or something on the tibia here. And diagnosing tibial avulsion fracture. So it's easy to diagnose someone. So first, when the knee is felt, there's a swelling and there's a softness or tenderness directly over the fracture, and the patient is unable to extend the knee to its fullest, so he can't straighten his legs. And even worse, the patient may also feel a movable fragment of bone. Oh my god, that's creepy. So, how do you treat tibial avulsion fracture? So, mostly all types of fractures, they include RICE therapy. That's called ice therapy, splint immobilization, and elevation should be used to avoid the swelling. That is, in other words, rest, ice, compression, and elevation. RICE. But type 1B, 2, and 3 require surgery. So as so the doctor will open the wound up and try to fix it with screws, 1 or 2 screws probably, so that the tibial tubercle and this proximal tibia is screwed together so the bones they heal quickly. And thank you.